Good evening. By the end of this speech, I will be able to persuade you that government assistance is being abused. Government assistance abuse is at an all-time high and needs to be put under control. I'm going to give possible solutions that can be the start to end some of the abuse. In the United States today, almost 1 million people are receiving some kind of government assistance. In the fourth quarter of 2011, 49.2% of Americans received benefits from one or more government programs, according to the data released by the Census Bureau. In total, the Census Bureau estimated over 151 million Americans out of population that estimated to just be over 306 million received benefits from one or more government programs during the last 3 months. Those 100 million beneficiaries equal 49.2% of the population. Most government assistance programs are designed to help needy families with low income. Some programs are Medicaid, TANF, and food stamps program, which is now called SNAP, and a program also called WIC. The system is being abused in the United States, and I see it every day personally. How many of you can say the same thing? I'm going to give you facts and also give my opinion on how this can be fixed. The beginning to now in government assistance. A food stamp program was established in 1939. The program has undergone some significant revisions since its first inception. There was also an 18-year gap between the end of the first program and the start of the second program. The official purpose of the Food Stamp Act of 1964 was strengthening the agricultural economy and providing improved levels of nutrition among low-income households. However, the practical purpose was to bring the pilot FSFP under control and to enact regulations into law. Now, Medicaid is a state and federal partnership. Each state runs its own program with federal financial support and oversight. Beyond a core set of mandatory covered services, Medicaid programs vary widely among states. Each state Medicaid program is required to have a system in place to protect program integrity, but again, these are a very wide variety. Some states have independent inspectors. General, others then have varied involvement from office to the controller, and others rely heavily on the state attorney general. Federal funding is available to some states for the Medicaid Management Information System. All states include review of claims by their paid as well as surveillance and utilize review to look for errors in claims that are paid in the Management Information System. Now that you have the facts and the history, let's get to the problem. The many ways government assistance are being abused. Millions of Americans participate in government programs, like SNAP, still commonly referred to as food stamps, in order to ensure that low-income households receive adequate nutrition. Currently, SNAP places restrictions on items that food stamps can buy. Bread, cereal, fruits, vegetables, fish, poultry, dairy products, as well as seeds and plants. Now, something that is not allowed is beer, wine, liquor, cigarettes, tobacco, non-food items, like food, soap, household supplies, medications, think hot foods as well. People sell their SNAP benefits for cash or other supplies. This is against the law and it's happening every day. Stores are allowing items that are not legally allowed to be purchased to even be used as SNAP benefits. I've even seen it be purchased for gas. Federal authorities announced on May 2nd that they had arrested 107 healthcare providers, including doctors and nurses in several cities, and charged them with cheating Medicare out of $452 million. Doctors and other healthcare facilities will bill patients that are not receiving care, and even at times people that were not even alive. And where every state struggles with Medicaid fraud, the Office of Inspectors General says that 5 topping the list are California, Texas, New York, Ohio, and Kentucky. The good news is that states recovered $1.7 billion in fraudulent payments in 2011. The bad news is the government spent $208 million to do it. This program has expanded rapidly over the last decade in the ways that are not justified by the recession that we went through. Michael Turner, a senior fellow at the Cato Institution, said, "There are very little bangs in this increased buck. The food stamp program needs reforms. Find that in 2000, the cost of food stamps was $17 billion. It has risen to $78 billion today. This goes to show how much the government system is increasing very fast. Finally, it's time to start fixing the problem. I believe recipients need to be drug tested to make sure that the taxpayers are not paying for a drug habit. I think it's a good start and may eliminate some of the abusers from the start. Also, for those receiving benefits and not working, should be required to take classes to help them find jobs and have to turn in active logs for job searching. I also think there should be some sort of cap or limit depending on what a person is capable of doing. I know the elderly may have limits on working, but for anyone who is fully capable of working, should have some sort of time frame to find a job while receiving benefits. I do believe that some people may need help, for these programs are designed to be temporary. They are designated to help families with low income and have trouble finding work or not making enough money. It's time to start putting restrictions and limitations and even time frames on these programs to help prevent them at some point from being long-term. Thank you.